We've been talking away, and it's been such a pleasure, and we can talk for hours on this topic, and maybe even days. What I want us to kind of close on is some key takeaways from your experience that all our viewers can start thinking about, that they can do themselves, for themselves or for their loved ones, with their loved ones. And you mentioned, we've all talked about kind of lifestyle interventions. Let's touch on the evidence base around, you mentioned the Dean Ornish study with regards to lifestyle intervention, the long-term follow-up on there. What is the best nutrition strategy? There's no one-size-fits-all, for sure, but generally speaking, let's start with nutrition.
Yeah. So I think the low-hanging fruit, a lot of people in this space, such as ourselves, and maybe some of our patients as well, are quite advanced in terms of their understanding around nutrition. But actually for most of the population, most Americans, most people in the UK, the low-hanging fruit, the first most important thing they can do is, and they don't necessarily need to do this forever, is break their addiction to ultra-processed food. That is the major issue right now, is processed foods, and which generally are a combination of, high in sugar, unhealthy oils, refined carbs, full of additives and preservatives, designed to be hyperpalatable and probably addictive as well. There's a lot of emerging science on that. And of course that makes sense from the food industry's point of view, because that's what they want to sell you, that food. For me, the first and most important thing is to eliminate that. And I'll tell patients, listen, this isn't forever. It doesn't mean that you can't enjoy a sugary treat, at some point, but break the addiction, go cold turkey, 3 to 6 weeks. Your palate will change, you'll start to feel better, and you'll see differences, and that then motivates them to carry on. And of course, from a heart disease perspective, and there are different approaches, and I'm very open, but I think my default approach is a low refined carbohydrate Mediterranean diet. When you look at the foods that, because heart disease, insulin resistance and chronic inflammation are kind of two sides of the same coin, two evils, if you like, of heart disease. So it's combating the insulin resistance by removing refined carbs, and making sure they're having anti-inflammatory foods. And the best evidence comes from foods like extra virgin olive oil, nuts and seeds, whole fruit vegetables, and oily fish. So these are the components I usually add in from a dietary approach, and it usually has a very, in most patients, if they adhere to it, they will notice an effect quite quickly from a nutrition point of view.
So it really is that easy?
Theoretically, yes, but the difficulty for people, any kind of behavioral change needs an effort at the beginning, and that the key is really motivating and explaining to those patients that because a lot of people come in with a mindset thinking it's just about weight loss, or whatever I do is going to take a long time to see an effect. And what I say to them, listen, you're going to see an effect in 21 days. And they're like, what? And some people, some of my patients have even sent their type 2 diabetes into remission in 21 days, right? So so that people can do. You give them that. Okay, listen.
That belief.
Think you can do this for. Yeah. Just do it for me for 3 weeks, 4 weeks.
Yeah.
Can you do it? Yeah. You know what? I think I can, doc.
Yeah.
So that's how you start. That's my initial approach.
So if I may, a couple other ideas of helping people out there get started. Make it 21 days.
Yeah.
Do you give them handouts, or how else do you help educate them to motivate them to?
Yeah, I mean, handouts or stuff online, or my books or whatever else, or I'll explain it to them, or just be very specific, eliminate all the starch and sugar, stick to these foods, and if they need further help or input, then of course I have, we have nutritionists here and other nutritionists that we can use that they can get extra help with. One of the things linked to it though, Mark, I think a lot of what drives some of this behavior, and that's, again, it's all a synergy of risk, a web of causation of risk, if you like, is chronic psychological stress in the way that we live. So often I will back up the dietary approach with some sort of stress reduction intervention. I work with a really good cardiac specialist nurse who's very good at breath work. And I gauge the level of stress with them as well. And if they're not particularly high stress, then fine, they don't necessarily, but a lot of them are. And therefore that helps them. If they're simultaneously studying breath work and meditation, it'll be easy for them to break their addiction.
Stress it was on my list.
Yeah.
So stress kills, and it seems to precede a lot of cardiac events.
Yeah.
Should we just touch upon what happens inside us when we're under high stress? Our sympathetic nervous system, our adrenal glands, our hormonal response. Mark, how do you investigate that how do you investigate from a functional medicine perspective someone's underlying biological state or effect of chronic stress on them?
One of the best markers is your heart rate variability, and it's a a measurement of basically your sympathetic tone or your fight or flight response. But usually you can get it from the story. What's going on in your life? One of my favorite authors is Michael Pollan. He's a nutrition author. If you go to the bookstore and look up one of his books, he has a lot of the same ideas you do. And we talk about the Mediterranean diet. Well, it's a little different in France than in Spain and in Greece and in the other parts of the Mediterranean. And if you eat a Mediterranean diet in your car by yourself while you're angry at the person next to you, there's a complete different chemical effect than when you're sitting around a table with people that you love or your dog. And it's not just the food, it's the environment in which you do it.
100%.
And the breathing teaching is, we teach everybody a 5-second in, 5-second out, put your hand on your belly before they eat. And we try to encourage them to take a walk after they eat. It's these easy things. For 21 days, that's all I need is 3 weeks for you to do it. Do a little breath work before you eat, take a walk after you eat. These little things can have huge benefits. And as you see too, as you get people to do one thing, they're more likely to start feeling better to do another and another. And then the whole wheel is spinning. And it's amazing when they come back to you how much has really changed for them without taking a medication.
What's the right exercise program to improve your blood vessel health and keep the vessels nice and open and healthy, elastic? What do you guys think?
What do you say in your book? How do you lay it out for
Yeah,
people?
so my co-author of my book and co-producer of the first film I did, a documentary called Big Fat Fix, Donald O'Neill, came up with this great line: exercise is overrated, movement is underrated. If you look at the blue zones, I'm sure you've studied this, Mark, as well, you look at the people that had these high levels these communities with high longevity.
Live longest.
These people weren't in the gym or panning in the gym, they were just outside, they were just moving constantly. From a heart disease perspective, I don't overcomplicate it. I think moderate exercise regularly, whether it's 30 minutes 5 times a week, is pretty good. I do have concern, and I've seen a few patients, and this is a minority, but it's still important. Overtraining, especially if you're stressed and poor sleep, is actually bad for the heart. And about 11% of elite athletes over 50 will have coronary calcium scores above 1,000. And I've seen some of these patients come to me, and everything is great, and you look at the calcium score, and they've got significant, potentially significant coronary artery disease, and you go through their history, and they have been pounding it. They've been running 10 miles a day or something like that. It's like, okay, well, you need to tone that down. So I just keep it simple for the exercise stuff. And certainly when it comes to even people who are specifically overweight or metabolic syndrome, most of the impact is going to come from diet. In fact, there's not been an intervention, any study that I'm aware of, where you reverse metabolic syndrome just from exercise. You keep it simple. And in fact, actually, if you over-exercise and you lose weight, etc., that is also not good for the stress hormones, good for your joints. So yeah, brisk walk, 30-minute brisk walk every day. But again, do what you enjoy. That's what you have to ask them. What whether it's cycling, swimming, walking, etc. Do something you enjoy. Don't overdo it, but make it regular. Okay. That's all I say.
It's good advice. Make it easy.
Yeah.
Then if things are not just easy but successful, and when you get one little success, you're willing to maybe take another risk and do another success, and they start to build on each other, and then your pathways start to shift.
Yeah. Even things like Pilates, I do Pilates once a week with a person that comes to my place, and I find it meditative, actually.
Absolutely, yeah.
I find it very meditative.
I love what you said about movement, and the easy way to do that is when you go to the store, take a couple laps around the long part of the inside of the store. When you park further away, take the stairs instead of the elevator. Do the little things in your day that just give you a little bit more movement. It doesn't have to be a 60-minute marathon run.
Any other lifestyle factors that our audience can consider? So we've talked about nutrition, movement, stress modification, and how to manage stress. We talked about community, the way you eat, considering kind of purpose, values in there comes into that, the social element of wellness.
I mean, on that community stuff, I think, quality of relationships. I mean, a lot of what drives poor health actually is chronic stress related to work or relationship stress. It's easier said than done. It may be, you may need a complete revamp of your social circle, but actually if you look at all of the studies on longevity and even mental health, the single biggest determinant of that is meaningful relationships. So really have a think about that, People who live in isolation, have risk of heart disease equivalent to being a heavy smoker.
Yes.
So it's a really big one. And there's a cultural issue there as well. I think we're spending a lot more time looking at screens, not interacting with each other. I see people in restaurants with their girlfriends or wives, no conversation going on. They're just looking at their screens. This is not good.
What's the future?
Staying off social media actually is probably a very good, except maybe for today. It's probably good advice, another lifestyle advice, minimizing.
So we've got some questions from the audience. If someone had calcified plaque in their heart, can you discuss how one would go about reversing that?
So similar lifestyle approach, looking at the data on reversal of heart disease, there isn't a lot of data out there, but the one most interesting study for me, which I think supports early studies by Dean Ornish, is done by a cardiologist in India called Satish Gupta. And he looked at, and this is the early 2000s, before people were taking statins, people who had at least moderate to severe heart disease, so 50 to 70% blockages, couldn't get a bypass or a stent or whatever, or didn't want it, put them on a healthy lifestyle program, which in India, they were devout Hindus, so it was a high fiber vegetarian diet. It was two 30-minute brisk walks a day. And then it was something called Raj Yoga meditation, 40 minutes of, it was really a spiritual transformation, but it was a form of breath work. And then he followed them up, and the people who had adhered to the lifestyle plan had an average reduction in the stenosis, the narrowing, of 20%. He then did a deep dive into the data. What was it? Was it the diet? Was it the exercise? The only independent intervention for reversal of heart disease was 40 minutes of Raj Yoga meditation a day. So I think it's a synergy, but I think it may well be more than anything else, could be the stress reduction. The question is around calcified plaques. Actually, the calcified plaques are the less likely to cause heart attack. Your soft plaques are the bigger problem. I don't know about whether you can reverse calcified plaques, but certainly the soft plaque reversal you can. I had a patient only recently, just within a year of changing his diet, going on a kind of low refined carb Mediterranean diet, had a 60% narrowing in his circumflex vessel disappear in 1 year. He hadn't even sorted his stress out at this point, just from dietary changes alone. But I would say do all three together.
Well, that's such a great way to look at it. There's kind of a trifecta we use in our clinic. Is we do the advanced testing for the additional blood markers that we talked about, and it's myeloperoxidase, plaque2, ADMA, SDMA, oxidized LDL, insulin, the A1C for blood sugar, CRP for inflammation, before we even look at the cholesterol, 4-part cholesterol.
Yeah.
And we then do a calcium score. And based on the data, if your calcium score as a man over 50 is 0, your need and benefit from a statin in the next 5 years is less than 3%. So it helps us to try to guide people. And if we see someone with a heavy plaque burden, we do a stress ultrasound called stress echo. So that's kind of the trifecta I've used in the last 20 years to help risk stratify people. The advanced blood testing, the calcium score, if it's 0, we stop. If it's a concerning looking pattern, then we need to go into a functional stress test to look at what their risk is immediately.
Yeah.
And I feel like that's a great way to screen for those people that are the canary in the coal mine kind of time bombs that you worry about.